Hello everyone, my name is Shraddha Regmi. I'm a registered nurse at Cotton White Hospital in Texas. In this video, I'll discuss different EKG rhythm interpretations. Understanding the EKG is a part of nursing care which helps us to prevent the different life-threatening conditions. This topic is especially important to us because apart from day-to-day use, we need to take a competency test every year in order to work in the hospital here in the United States. There are a few fundamentals we need to know before we jump into applied clinical practice. In the picture, we can see the EKG waveform, where we can see the P wave, the QRS complex, and the T wave. Let's see the steps that we can interpret the rhythm. The number one is rates. The P waves is the arterial rates and the QRS is a ventricular rates, which is multiplied by 10 gives us a heart rate. Number two is rhythm. We have the arterial and ventricular rhythm, which is regular versus irregular. P wave. Normally the P wave is upright, one in front of every QRS complex. Absence of P wave may indicate some problem. PR interval. PR interval is usually measured from the beginning of the P wave to the beginning of the QRS complex. The distance of the PR interval is 0.12 to 0.20 seconds. QRS complex. It is narrow versus wide. The normal QRS complex is 0.12 seconds. If it is greater than the number, it is wide. If it is less, it is narrow. In this video, we will start with some sinus rhythm. Some of sinus rhythm frequently observed are normal sinus rhythm, sinus bradycardia, sinus tachycardia, sinus arrhythmia, sinus arrest. Normal sinus rhythm. What is normal sinus rhythm? Rhythm of the healthy heart. It means the electrical pulse from the sinus node is being properly transmitted throughout the heart muscles. Let us see how does the normal sinus rhythm looks like in EKG strips. Here we go. You see the small P wave in front of every QRS complex, which looks like regular. Let us see what are the characteristics that denote the normal sinus rhythm. The rates should be consistent with 60 to 100 per minute, both the arterial and ventricular rates. Rhythm, it should be regular. The distance between the P interval and the R interval should be equal. P waves should be present upright and one in front of every QRS. PR interval, the distance between the PR intervals should be 0.12 to 0.20 seconds and it should be consistent. QRS complex should be narrow in every normal sinus rhythm. Sinus bradycardia. Sinus bradycardia is a slow heart rate that occurs during the sleep. For example, a trained athlete can have resting heart rates in 40s even while they are awake. Some people having low heart rate while they are awake, they may have a disorder called sinus node disease or called a sick sinus syndrome, which can cause them to get tired easily, may experience symptoms such as lightheadedness and fainting. Sinus node disease is often treated with pacemakers so that they can have a good sinus rhythm. Let us see how does the sinus bradycardia looks like. Here you see sinus bradycardia on the EKG strips on the right hand side. Let's see what is the characteristics of sinus bradycardia. It does have the rates less than 60 per minute, that is the arterial and ventricular rates. Rhythm with a regular rhythm, both arterial and ventricular rhythm. P wave is always present in upright and one in front of the every QRS. PR interval is consistent with 0.12 seconds to 0.220 seconds. QRS complex is narrow. Sinus tachycardia. It is the high end of normal range of heart rate, can increase during the exercise. It is allowed to pump the extra blood throughout the body to fuel the physical exertion. Sinus tachycardia can happen on extreme stress, medical conditions like hyperthyroidism, anemia, and fever. Let's see how does the sinus tachycardia looks like in EKG strips. The characteristics. It does have the rate of 100 to 160 beat per minute. Rhythm looks like it is regular with the arterial and ventricular rate. P wave is present upright, one in every in front of the QRS. PR interval is 0.12 to 0.20 seconds and it is consistent. QRS complex is always narrow. Sinus arrhythmia. What is sinus arrhythmia? It is an irregular heartbeat that either too fast or too slow. One of the type is respiratory sinus arrhythmia. The heartbeat changes pace when you inhale and exhale. In other words, your heartbeat cycles with your heartbeat. When you breathe in, your heart rate increases, which is easily noticed during sleep. Let's see how does the sinus arrhythmia looks like in EKG strip. Here you go. Let's describe the characteristics of sinus arrhythmia. The rate, variable but arterial and ventricular are equal. Rhythm, it is irregular where the arterial and ventricular rhythm. P wave is present upright, one in front of every QRS. PR interval is 0.12 to 0.20 seconds and it is very consistent. QRS complex is narrow. Sinus arrest. What is sinus arrest? A cessation of sinus node activity for a short period of time. It is caused by the degenerative changes of sinus node. It may feel like you are going to pass out or feeling like your heart is skipping beats. It may be too fast or too slow. Sometimes you may feel like having a chest pain, lightheadedness, etc. Let's see how does the sinus arrest look like in EKG strip. Here you can see the pause between the heartbeat. Rates are variable, but arterial and ventricular rates are equal. Rhythm, it is irregular because of the pause. P wave is present upright, one in front of every QRS. PR interval is 0.12 to 0.20 seconds and is very consistent. QRS complex is narrow. Arterial rhythm. Let's discuss here in this slide about the arterial rhythm. What are the arterial rhythm? They are supraventricular tachycardia, which is also known as SVT, atrial fibrillations, arterial flutter, premature arterial complexes. Supraventricular tachycardia, which is also known as SVT, the rapid heartbeat that develops when the normal electrical impulses of the heart are disrupted. Abnormally fast or erratic heartbeat that affects heart upper chambers. It is also called as paroxysmal supraventricular tachycardia, where in the patients you see the complaint of chest pain, fainting, sweating, lightheadedness, fast heart rate, shortness of breath. Let's see how does the EKG strips looks like for the SVT. The characteristics for this SVT is the rate is always greater than 160, where you count the atrial or ventricular, either it's always greater than 160. Rhythm is regular, it looks like regular. P waves, you may not be able to see the P waves in SVT. You may not able to measure the PR interval either. The QRS complex seems very narrow. Atrial fibrillation is an irregular, often rapid heart rate, commonly caused by the poor blood flow. Symptoms are palpitations, shortness of breath, chest pain, dizziness, fatigue. It is often treated with blood thinners, beta blockers, cardioversion, and minimal invasive procedure. Here is the EKG strips of atrial fibrillation shown in the picture. The atrial fibrillations characterized by the rates are variable with the ventricular rates. Rhythm is irregular. P waves, you cannot find P waves in atrial fibrillation. Neither you can measure the PR interval. QRS complex is very narrow. Atrial fibrillation with rapid ventricular rate, which is also known as AFib with RVR. You can see the EKG strips on the right hand side with a ventricular rate of 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. So it is a life-threatening condition if the patient presents with AFib with RVR. Rate is always greater than 100. Rhythm is irregular. You can see P wave. You cannot see P wave in the AFib. You cannot measure the PR interval either. QRS complex is very narrow. Atrial flutter is a condition in which the heart's upper chamber beats too quickly. Following symptoms like palpitation, shortness of breath, and dizziness occur in the patients, which is often treated with beta blockers, calcium channel blockers, and anticoagulants. Here you see the picture of the atrial flutter. Rates is variable, rhythms is variable, P waves is flutter waves called sawtooth, PR interval is unable to measure, QRS complex is narrow. Premature atrial complex, which is also known as PAC. A common kind of arrhythmia characterized by the premature heartbeats originating in the atria, where you can see the premature beats. Rates is variable. Rhythm is broken up because of something happens too early. P waves early depolarization will look like different than a P wave. PR interval depends on the underlying rhythms. QRS complex is narrow. Junctional skip rhythm, where the patients may feel like lightheadedness, palpitation, chest heaviness, shortness of breath, and weakness, which have the characteristics of rates is from 40 to 60 per minute. Rhythm looks regular. P waves is absent, inverted, or followed by QRS. PR interval is usually short if you can measure it. QRS complex is narrow. Escalated junctional rhythm. Here you see the picture of escalated junctional rhythm. Characteristics of rate 60 to 100 per minute. Rhythm is regular. P wave is absent, inverted, or followed by QRS. PR interval is usually short if you can measure it. QRS complex is narrow. Junctional tachycardia. Here you see the picture of junctional tachycardia. Characteristics. Rate is always greater than 100 per minute. Rhythm is regular. P wave is absent, inverted, or followed by QRS. PR interval usually short if you can measure it. QRS complex is narrow. Premature ventricular complex. This is a unifocal with identical shape. This is a multifocal which have a more than one shape. Triplet PVCs occur in a group of 3. Ventricular tachycardia, monomorphic. Ventricular tachycardia is a condition in which the lower chamber of the heart beats quickly occur due to the problem with the heart electrical impulse. The condition may develop as a complication of a heart attack and may occur with a patient with certain conditions such as valvular heart disease. Symptoms include chest pain, fainting, dizziness, and shortness of breath. As we can treat with the beta blockers, antiarrhythmic drugs, DFIs, CPR, cardiac monitoring, etc. This is a monomorphic VTAC. Rate is always greater than 100. Rhythm is regular but may vary. P waves cannot see them. PR interval, you cannot measure the PR interval. QRS is very wide. Polymorphic, where you can also call these torsades points. Rate is greater than 100. Rhythm is irregular. P wave cannot see them. PR interval cannot measure. QRS complex is wide. Ventricular fibrillation is also called as VFib. It is a life-threatening heart rhythm that results in the rapid inadequate heartbeat. Heart does not pump the blood to the rest of the body. It can be triggered by heart attack. Symptoms with low blood pressure, loss of consciousness, and death. The treatment is emergency treatment with AED, automated external defibrillator, and CPR, cardiopulmonary resuscitations. Let's see how does the ventricular fibrillation look like. Here is the picture. There is 0 rates, 0 rhythm, no P wave, no PR interval, nor the QRS complex. Asystole is a flat line represents a cessation of electrical and mechanical activity of the heart. There is no rates, no rhythm, no P wave, no PR interval, no QRS complex. Thank you so much. If you have any questions, please comment on the comment section. Have a good day.